Hey mamas, it's your CajunStork here. Today we're going to talk about many common reasons why you might have a headache in your pregnancy and some natural ways to relieve them. But before I begin, my name is Midwife Kyra and I believe in truly natural birth because I know that it makes for better birth experiences. Consider subscribing to my channel and don't forget to join us every Midwife Monday for a new video. Also, if you want to look in the description below, I have a link to my pregnancy complaint kits where I offer some herbs and natural remedies from my own practice to help you with some of your pregnancy complaints. So let's get started. There are many reasons why you might have a headache in pregnancy. Some of them can be really alarming and require medical intervention, and some of them are just really common ailments that I can give you some midwifery tips to help relieve. One of the most common reasons I see in my practice that mamas have a headache is actually dehydration. Believe it or not, dehydration is a major problem among pregnant women, and actually just talking to some of my chiropractor friends and acupuncturist friends, they say that dehydration is a pretty common problem among Americans altogether. Now the thing is I can tell you to drink water all I want, but you may not know how much water to drink to meet the needs of your pregnant body. So a very simple formula is to take your body weight in pounds, divide it by 2, and that's how many ounces of water you need to drink in a day. You've probably seen this in some of my other videos about how to calculate this. The one thing I want you to keep in mind is each trimester you need to be adjusting how much water you need to drink because your weight's changing every trimester. Another common reason that mamas might have a headache in pregnancy is eye strain. Your eyes, along with many other parts of your body, are changing so often in pregnancy. And so it's not uncommon to have a change in your prescription if you're already wearing contacts or glasses, or just in general having eye strain from all the up-close reading you're doing now that you're newly pregnant and trying to get in the know and all the things going on. If eye strain is actually causing you problems to the point of having headaches in pregnancy, it is a good idea to go ahead and go see an ophthalmologist or an optometrist to go ahead and get yourself a new prescription. However, keep in mind that that prescription is probably going to change somewhere between 6 weeks and 12 months after you give birth. So I wouldn't recommend you go out and buy the most expensive pair of glasses or expensive pair of contacts to get you through that time. Another reason you might have a headache in pregnancy is too much sugar. I cannot tell you how many mamas think that they're eating for 2 when they're pregnant, or because everything tastes so good when you're pregnant and you're having cravings that you're starting to want to eat more sugary foods when you're pregnant. And it definitely doesn't help with things like baby showers and such that everyone's buying as cakes and cookies because again, we're eating for 2. You guys, having too much sugar in your pregnancy can not only cause headaches, but if you're borderline gestational diabetic, having too much sugar can definitely cause some problems in your pregnancy. If you find yourself craving sugar, however, a midwifery tip I want to give you is moms who crave sugar actually need to be increasing their protein. Moms who crave sugar are deficient in protein, and so as a pregnant mama you should be eating at least 70 grams of protein a day, and if you find yourself with a sweet tooth you probably need more of it, so keep that in mind if you're starting to have headaches and you know maybe your diet could use a little bit of tweaking. Low calories in pregnancy is another reason why moms might have a headache. It's not uncommon for mamas to be too busy taking care of other children to even focus on the fact that they're pregnant. Maybe you're a working mom, or even if you're a stay-at-home mom chasing babies, it's really important that you get enough calories and enough protein in each day in your pregnancy, and if you don't, you might find yourself with a headache. An easy way to keep track of this is to simply create a diet log so you can hold yourself accountable so that you know exactly how much of what kind of foods you're eating each day. It's a little tip we use in our practice to help make sure our mamas are getting plenty. Now, if you're a mama who works out regularly, it's even more important that you consider the diet log because it's not uncommon for mamas who work out really hard in pregnancy to have headaches from not eating enough calories and enough protein. So again, you want to keep an eye on your diet and make sure you're getting enough nutrition while you're pregnant. Neck tension can be a very common cause of headaches in pregnancy, and if you're predisposed to migraines, you might also experience an increase of those when you're pregnant. Now, I have heard about 1/3 of my clients actually experience a decrease in migraines when they're pregnant, which is really awesome. But if you have a history of migraines and you haven't yet seen a chiropractor or a massage therapist, I highly recommend you guys start and make a phone call today to someone who specializes in the Webster technique so that they can focus on you in pregnancy. Neck tension actually can cause migraines and frequent headaches in pregnancy, and you might think you have it under control and that's not what it is, and you don't know why you have migraines, but I cannot tell you how many times I've successfully had mamas treat their migraines in pregnancy by simply getting massages and getting chiropractic care. So if that's you, you want to start today. The last and probably the most important reason why you might have a headache in pregnancy, and also the most alarming, so I want you guys to watch this entire section, is preeclampsia. Preeclampsia is one of the most dangerous things we can encounter in our pregnancy, and it's one of the biggest reasons why we receive prenatal care when we're pregnant, so that our healthcare providers can rule out preeclampsia. Preeclampsia can actually progress to eclampsia, and eclampsia can actually cause harm to your body and even death. So it's really important that you take the warning signs of preeclampsia seriously. One of the first and most prominent warning signs of preeclampsia is a severe headache, particularly if it's associated with sudden swelling in the feet, in the hands, or in the face. A lot of times moms will even have flashes of light, they might have upper right side pain, and another thing that they often see is high blood pressure. If you are experiencing high blood pressure, particularly the numbers of 140/90 or above, your healthcare provider is probably already watching you for preeclampsia warning signs. If you're watching this video and you're having a headache with dizziness, blurred vision, upper right side pain, and sudden severe swelling, it's so important that you stop what you're doing right now and go to your healthcare provider. Preeclampsia can escalate quickly. I've seen it escalate in as early as an afternoon from a mom who comes in just slightly having a headache to have full-blown pre-E by the end of the day. So if you're dealing with a headache and you're not having any of the other symptoms that I discussed earlier, dehydration, anything like that, then you definitely want to call your healthcare provider to rule out pre-E. There's several reasons in pregnancy that you could have a headache that are completely normal, but if you're having symptoms of this associated with some of those preeclampsia symptoms, it's so important that you guys get it checked out. Otherwise, I hope that you can use some of these midwifery tips and tricks to help make your headache better and improve your pregnancy complaints. If you have any other questions, you can go ahead and post them in the comments below. Otherwise, I hope to see you next Midwife Monday for another video. Thanks for watching. Bye-bye.